I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. So the next point I'll address is head support for a baby. So many of you might have seen a head support similar to this for a newborn baby, and one of the reasons these come into the picture is because of the predisposition to flattening of the back of the head. So if the baby tends to prefer to lie on one side, either the head gets elongated or it gets flat on one side and starts bulging out on the front on the other side. So this is a common problem called plagiocephaly. In a premature baby or a growth restricted baby, their skull is fairly soft and elongated skull is quite common as well. So it's always good to keep the head in the midline if possible, and these kind of supports can assist you. The other thing you can do is rotate the baby tummy time when the baby is awake. Don't allow the baby to sleep on the tummy till the first 3 to 4 months. Again, if you have questions about sudden infant death risk, message me on the YouTube by commenting and I will share the relevant video with you on how to prevent it. So the main component here is that the part where the head will rest will be hollow. The sides are raised on the 3 sides. It's like a horseshoe, but the part where the neck is resting should be flat. So it shouldn't be raised, because if the neck area is raised, it may cause the head to bend down and that blocks the breathing, and babies are not strong enough to move themselves easily. So you should make sure that you're buying the right support. There are many duplicates which come like a full circle, which is like quite thick all around, and invariably it will cause problems with the neck bending. Remember that anything that obstructs the baby's airway, don't have any broad sheets on the bed, don't have anything loose or soft toys on the bed. So anything that obstructs the breathing is not safe in the immediate period. Same way with the co-sleeping with the baby. If you're tired, don't put the baby on you and sleep, and don't breastfeed and sleep at the same time. It's always better to be reclining or sitting up while breastfeeding. One of the reasons is that if you lie down and breastfeed, there is a bigger chance of the milk reflexing up. We have a connection from the inner part of the throat to the ear. It's called the eustachian tube, and it's quite short in babies. And this milk regurgitating against the eustachian tube causes some inflammation, and some babies come with even perforated eardrum with milk-like discharge. It's not infection, but it's due to the regurgitation and the milk flowing out. So this obstruction of the eustachian tube may cause the baby to be uncomfortable and cry excessively as well. So remember that if you lie down and feed, there is a chance of ear congestion and even perforation of the eardrum in the small baby. So try to be reclining or sitting up, and try to be alert as far as possible. Even though we advise feeding and sleeping in the lactation courses, I mean, it's not absolutely safe, and it's better to be alert and feed and sleep back again. So this is another option to position the baby slightly upright. There are babies who have excessive colic or reflux, and keeping them about 30 degree up is useful. These have straps as well, which will keep the baby safe, and right from 10 days to 2 weeks onwards, you can start using these. These are called baby bouncer chairs, and car seat can be used for the similar purpose as well. During the night, you can keep the baby in a basket next to you. Baby baskets are available, and you can elevate that by keeping something underneath the basket to slope it. Folding a towel is okay, but it should be sloping the whole baby. The position, the sloping is not needed in all babies, but those who have proneness to reflux and crying episodes or spitting up frequently, you can consider using this. And of course, the baby starts looking around, and it's a good aspect to monitor. Positioning the baby this way reduces the effect of gravity on the head shape. So this is another way to avoid head shape abnormalities.